Have you ever felt overwhelmed by too much of something? Too much clutter in your home? Too many notifications on your phone? Or perhaps too much information coming at you all at once? There's a natural human inclination to simplify, to streamline, to get to the essence of what's truly needed. This very human drive finds a fascinating and critical parallel in the world of research, where a concept known as minimization plays a surprisingly profound role. Today, we're going to explore this idea of minimization, but not just as a general concept. We're going to uncover its two distinct, yet equally vital applications within the scientific landscape. It's a journey into how researchers strive to reduce specific elements, whether to improve the fairness and validity of a study, or to protect our most personal information in an increasingly data-driven world. While their goals differ, both branches of minimization are about making things more precise, more ethical, and ultimately more beneficial. Let's start with the first area, minimization in clinical trials. Imagine you're trying a new medicine, and researchers need to compare it against a standard treatment, or perhaps a placebo. To make sure the comparison is fair, they typically divide participants into different groups. The gold standard for this has traditionally been simple randomization, like flipping a coin for each person. But what if, purely by chance, one group ends up with far more younger participants, or more people with a less severe version of the illness? This could skew the results, making it hard to tell if the new medicine truly works, or if the differences were just due to these pre-existing imbalances. This is where minimization comes in. Think of it like a meticulous, thoughtful way to balance teams for a game. Instead of just randomly picking players, you look at key characteristics, maybe their skill level or their age, and then you strategically assign them to teams to ensure each team has a roughly equal distribution of these traits. In clinical trials, minimization is an adaptive method. It doesn't just assign people blindly. Instead, as each new patient joins the study, the system looks at the characteristics of all the patients already assigned, things like age, gender, or disease stage. Then it strategically assigns the new patient to the treatment group that will best help balance out these important characteristics across all groups. This careful, dynamic balancing act ensures that any differences observed at the end of the trial are much more likely to be due to the treatment itself, rather than to pre-existing disparities between the groups. It was a groundbreaking idea introduced back in the 1970s by researchers like Donald Taves, and it continues to be refined with modern software tools designed to handle this complex assignment process. However, even with such a thoughtful approach, there are challenges. Because minimization isn't purely random, some researchers worry it could introduce what's called selection bias. This means there's a slight chance that someone involved in the study could potentially predict which group a patient might be assigned to, which could unconsciously influence their decisions. This predictability can also make it harder to maintain blinding, where patients and even their doctors don't know who is receiving which treatment, which is crucial for unbiased results. There are also statistical considerations. The traditional statistical methods we use to analyze randomized trials might need slight adjustments when minimization is used. Despite its clear benefits in creating well-balanced groups, minimization is actually quite underutilized, appearing in less than 2%.
Now, let's pivot to the second, equally vital meaning of minimization, data minimization. If the first concept was about reducing imbalance in clinical trials, this one is about reducing the amount of personal data we collect, process, and store. In our modern digital world, where data is often called the new oil, this principle is a cornerstone of protecting our privacy. Think about it. Every time you sign up for a new app, create an online account, or even just browse a website, you're often asked for information. Data minimization says that organizations should only collect the absolute minimum amount of personal data necessary to achieve a specific, legitimate purpose. If an app to track your daily steps doesn't need your full social security number, it shouldn't ask for it. This principle has several key tenets. First, limited data collection. Only gather data that's truly pertinent to the task at hand, avoiding anything excessive. Second, purpose limitation. If you give your email for a newsletter, that data shouldn't then be used for unrelated marketing campaigns without your explicit consent. Third, data retention. Organizations shouldn't hold on to your personal data indefinitely. Once the purpose for which it was collected has been fulfilled, it should be deleted, made anonymous, or pseudonymized, meaning it's modified so it can no longer directly identify you. These techniques, anonymization and pseudonymization, are powerful tools for protecting privacy while still allowing data to be used for research or analysis. Data minimization isn't just a good idea, it's a legal requirement in many parts of the world. major data protection laws, such as the European Union's General Data Protection Regulation, or GDPR, and the California Consumer Privacy Act, or CCPA, place this principle right at their core. These regulations are designed to give individuals more control over their personal information and hold organizations accountable for how they handle it. But even here, navigating the waters of data minimization isn't always straightforward. One of the biggest debates revolves around balancing data utility with privacy. Businesses, especially those leveraging artificial intelligence or machine learning, often find that more data can lead to better insights or more accurate models. So where do you draw the line between what's necessary for innovation and what's excessive for privacy? This interpretation can be subjective and is a continuous point of discussion. Implementing data minimization also requires a significant organizational culture change. It means shifting from a collect everything just in case mindset to a collect only what's essential philosophy, which can be a monumental task for large companies. And of course, the regulatory landscape is constantly evolving, demanding that organizations stay vigilant and adapt to new interpretations and requirements. Failing to do so carries significant risks, including data breaches, legal penalties, and a loss of public trust. So, we've explored two very different applications of minimization in research. In clinical trials, it's about minimizing imbalance to ensure fair comparisons and reliable results. In data privacy, it's about minimizing the collection and retention of personal data to protect individual rights and foster trust. Both are about careful, deliberate reduction, but for distinct, equally crucial ethical and practical reasons. Data minimization in particular is trending more than ever. With increasing global concerns about privacy, the proliferation of personal data online, and the rapid advancements in AI and machine learning that thrive on data, the need to define and enforce what is necessary and relevant data has never been more urgent. The future will undoubtedly see continued efforts to refine these interpretations, embedding a privacy-first culture deeper into organizations worldwide.
For clinical trials, while the complexities of minimization have limited its widespread adoption, its proven effectiveness in balancing patient characteristics suggests a future where overcoming these hurdles, perhaps through user-friendly tools and better reporting standards, could lead to its more frequent and sophisticated use. Integrating clever quasi-random elements to preserve blinding, for instance, could make minimization even more appealing. Ultimately, whether we're talking about carefully balancing groups in a study or diligently protecting our personal information, the spirit of minimization is about striving for precision, effectiveness, and ethical practice. It reminds us that sometimes less truly is more. By understanding these principles, we can appreciate the thoughtful work behind the scenes that aims to make research more robust and our digital lives more secure.